Audience joining me tonight for my presentation. So my presentation is raising awareness of drug prevention in my community. As a nurse, I see so many patients that come in with positive drug screens, mostly being marijuana, cocaine, and methamphetamines. So tonight I'm going to talk about how to raise awareness and help decrease the amount of drug use in my community. So first I'll start off by defining what drug addiction is, and as defined by the National Institute on Drug Abuse, drug addiction is a chronic disease characterized by compulsive or uncontrollable drug seeking and use despite harmful consequences and changes in the brain, which can be long lasting. These changes in the brain can lead to the harmful behaviors seen in people who use drugs. So just to give some statistics on drug use in the United States, 21.5 million Americans battled a substance use disorder in 2014. Of these 21.5 million Americans, approximately 1 out of every 6 young adults, which is equivalent to 16.3%, this group made up these 21.5 million Americans, and this is the largest group out of any of them. By the end of this presentation, I hope that my audience will have a better understanding of the need for raising awareness for drug prevention and understand the high amount and all these statistics and factors that go along with drug use in the United States. There are many negative effects related to drug use, not only including health factors, but crime and so much more, even leading to death. So this is a great reason for the need for drug prevention awareness. The group that is at greatest risk of developing a drug addiction is adolescents, because at this period of time, they're more susceptible to trying these things, peer pressure, things such as that. So if we can educate them at a young age, these negative factors of using drugs and the risk factors of becoming a drug user or addicted to drugs, if we can educate them on this, we can hopefully help prevent them even trying in the first place. For my PICO question, it's how do methods such as extended education on drug prevention and use of an educated committee help to decrease the number of drug addictions in the United States as compared to previous methods of decreasing these addictions? So, as I mentioned, adolescents are at greatest risk. So, I did some research, and there are actually research-based programs for these adolescents that have been shown to greatly decrease the risk of them using drugs. I have the correlation of drug addiction and crime. I have some statistics on this, and I actually found that nearly 50% of both jail and prison inmates are clinically addicted to drugs. And approximately 60% of individuals arrested for crimes test positive for some type of drug. So then I just have some facts on these drugs that I mentioned that I see patients testing positive for the most. Some facts on cocaine. Actually, 38.7 million people aged 12 or older have tried cocaine in their lifetime in the United States. Some symptoms of cocaine use long term are loss of sense of smell, nosebleeds, nasal damage, trouble swallowing, weight loss, severe depression. And there's actually no drug or medication that has been introduced for the treatment of cocaine abuse. So some facts on marijuana. Long-term effects are mental health problems, chronic cough, frequent respiratory infections, increased risk for cancer, There's also no FDA approved medications to treat marijuana addiction as of right now either. On methamphetamine, some facts. The long-term effects of this include anxiety, confusion, insomnia, mood problems, violent behavior, hallucinations, delusions, weight loss, and so much more. There's also no FDA-approved medication for methamphetamine addiction. So prevention is the greatest way to decrease the amount of drug use there is in the United States. And as I mentioned, teaching adolescents at a young age all these negative effects of drug use can hopefully help decrease this number. So the research-based programs that I mentioned earlier, there's actually 3 different types. The first one is universal programs, which addresses risk and protective factors common to all children in a given setting, such as a community or school. And the second type is selective programs, which target groups of youth who are at increased risk for using drugs, such as bad home life, mental health disorders, things such as that. And then the third program is an indicated program, and this type of program is actually created for those who have already used drugs. So, as I mentioned, there are certain risk factors for those who might become addicted to drugs or use drugs, and some of these risk factors that we can identify even in adolescence include aggressive behavior, lack of parental supervision, poor social skills, the availability of drugs at school. This is a big one. And then community poverty, which is very common in my community and has a lot to do with the great amount of drug use that goes on. A chaotic home life, academic failure, peer influences, as I mentioned already, mental health disorders. These are all risk factors for using drugs. So, in order to help reduce the amount of drug use, drug addiction in my community, I plan to create a committee full of health care workers and public safety officers to help educate these young children and adults in my community on the effects of drugs, what it leads to, all these negative things. So I'll have to have collaboration with all of them. Education, they will have to be very greatly educated in order to educate the people of our community on how to decrease the use of drugs. I plan to create flyers, educational handouts, just to leave around the community and doctor's offices and the hospital for patients just to get when they're there, just to read and educate themselves. It's in a way just as simple as that. Evaluation of success of this project can obviously be measured by a decreased amount of drug use in our community. Also, decreased amount of crime. This will show that this project has been successful. Also, it can be measured by these the individuals of our community attending these educational classes that I plan to have put on by my committee. So hopefully, with the success of this project, all individuals in my community will be educated on the negative effects of drug use, how to prevent drug use beginning in our adolescence, how to help those that are addicted to drugs. So education is my main goal. As you can see, the need for drug awareness is very large in all of the United States, not just in my community. So with education and proper teaching of individuals in each community, this can hopefully help decrease the amount of drug use all over the United States. And that's it. Thank you for listening.